This is a case of Pemphigus vulgaris in a German Shepherd adult. So the presenting signs include erosions, ulcers, scales, erythema, alopecia, crusting, and scarring throughout the body. So the lesions are multifocal, but more common on the face, the ears, and the body trunk, including the distal extremities. Typically, these lesions occur on the skin, in the axilla and groin region, extending to the limbs, and then also around mucocutaneous junctions, at the nail beds, at the muzzle, nails, and also around the eyelids. There might be concurrent fever and lethargy in the affected cases. So this is another region that has got extensive ulceration, scaling, erythema, and alopecia and crusting. So cleanse off the surface with dilute and set it to help soften the fur, and also assist when you clipping the fur. Clip off the area with a razor blade, starting from an area where there is normal tissue. So clip around the affected region, including normal tissue, will help one to assess the wound day in, day out for wound healing. If you don't include normal tissue, it will be difficult to assess whether the wounds are healing or they are not. So clip around the fur first to limit after clipping around the fur, around the wounds. That's when you start clipping on the affected region. As you are clipping on the affected surfaces, you are also achieving some form of surgical debridement. Although essentially, it's best to use a surgical blade when doing so. But as you are shaving, you are also achieving some form of surgical debridement, which is basically surgical removal of dead tissue from the affected region. So all the shaved areas will appear reddened and there will be some form of bleeding, but this is okay, as this will allow blood flow into that region and then also open up the area. So the removal of dead tissue is important in wound healing. If the tissue is not removed, that area will start dying off, and that will hold further wound healing. So after clipping, clean off with some antiseptic using a swab, and then clear off as much fur as possible, as this fur contains the largest amount of bacteria, which further impedes healing. After that, you can do chemical debridement using hydrogen peroxide. So dilute 1 part of hydrogen peroxide in 4 parts of water, and then apply on the wound to achieve chemical debridement. This will further kill off any other dead tissue that might be remaining on the surface. And it's also some form of antisepsis. Then dab off the area with a swab. After wound cleansing and chemical debridement with hydrogen peroxide, you can lavage the area with normal saline and then apply some antiseptic again. After that, then you can apply some topical antiseptic or a combination of antifungal, antibacterial and anti-inflammatory products like for sure. In other cases, you can apply activated charcoal powder, which we did in our case, or you can also apply Acrisalve or gentian violet paint. Those are the basic options. But in our case, we applied some activated charcoal. But in other regions, we applied the GV paint. So it depends on what you have at the clinic. So apart from surgical treatment, there's medical treatment. In our case, we are giving prednisolone daily for approximately 4 to 10 weeks. Then tapering off the dose over several weeks. Then you are also treating against secondary bacterial infection through systemic antibiotics using cotrimoxazole, then followed by ciprofloxacin for some weeks. And then we are also giving anti-allergy medication, cetirizine, to work in conjunction with the prednisolone. Postoperatively, after every treatment process, you keep the dog in a cone to prevent it from trying to bite off at the affected regions, which might further worsen the skin condition. So keep it in a buster collar and then possibly limit its movement. Now, in addition to the surgical treatment, the dog needs to be put on medical treatment. So this could be a 3-fold or 4-fold form of treatment. So you can give an immunosuppressive dose of prednisolone or methylpred daily for approximately 4 to 10 weeks. Then taper off the dose over several weeks. Then secondarily, you can treat against secondary bacterial infections through systemic antibiotics for some weeks. So in our case, we are giving initially Septrin, then we followed it up with ciprofloxacin. Then, depending on what is also presenting, you can add other medications. So in our case, we're also giving anti-allergy medication to augment prednisolone. So we're giving cetirizine once a day for approximately 7 days. Then we're also giving antifungal medication, fluconazole, once a day for a period of almost 14 days. So in place of the prednisolone, you could go for other alternatives like the non-steroid or immunosuppressive drugs like azathioprine, cyclosporine, or cyclophosphamide. Or you could go for glucocorticoids like triamcinolone. If there's concomitant infection with let's say mange, you could put the dog on Tularena, which in our country comes in the form of Bravecto. This will cover ticks, fleas, mites, and other ectoparasites that may affect the dog. As an alternative, you could just dip the dog liberally to prevent toxicity of the dip. In our case, we gave the dip towards the end of the treatment duration when the lesions had resolved. This is the same dog that we are treating against Pemphigus Vulgaris. This is 17 days after the initial presentation of the dog. So as you can see, all the thematic lesions have cleared. 2, the itchiness is completely gone. So what is remaining is the dry scabs, which eventually will fall off, and then also those areas of hairlessness will eventually grow back. Thank you for watching this video. I would appreciate if you are subscribed and like the video. This will help us to put out more videos for you. Thank you very much.